What is the pre-hospital management for ethylene glycol? Supportive care, IV fluids for dehydration and renal perfusion, ethanol therapy. What is the route of exposure for iron in a toxicologic emergency? Oral. What is the mechanism of toxicity for iron in a toxicologic emergency? Direct corrosive effect on gastric and intestinal mucosa, fluid loss from GI tract, and vasodilation of vessels, impaired generation of ATP. What are the phase 1 signs and symptoms for iron in a toxicologic emergency? 1 divided by 2 minus 2 hours, vomiting/diarrhea, lethargy, coma, pallor, tachycardia, hypotension, acidosis, hyperglycemia, hypervolemia, shock, renal failure, death. What are the phase 2 signs and symptoms for iron in a toxicologic emergency? 2 to 12 hours, relatively asymptomatic. What are the phase 3 signs and symptoms for iron in a toxicologic emergency? 12 to 48 hours, GI perforation, coma, seizures, shock, hepatorenal failure, coagulation defects, hypoglycemia, severe metabolic acidosis. What are the phase 4 signs and symptoms for iron in a toxicologic emergency? 48 plus HRS, pyloric strictures, death or recovery occurs. What is the pre-hospital management for iron in a toxicologic emergency? Supportive care, fluid resuscitation in cases of volume depletion. What is the generic name for isopropyl alcohol? Rubbing alcohol. What are the routes of exposure for iron in a toxicologic emergency? Oral, skin contact, inhalation. What is the mechanism of toxicity for isopropyl alcohol in a toxicologic emergency? Is a CNS depressant and vasodilator, metabolized to acetone in liver. What are the signs and symptoms of isopropyl alcohol? Intoxication, CNS depression, hypotension, cardiac ischemia or infarction. What is the pre-hospital management for isopropyl alcohol? Supportive care, assisted ventilation and fluid therapy, charcoal and gastric lavage. What is the route of exposure for lithium? Oral. What is the mechanism of toxicity for lithium? Replaces sodium, can result in permanent neurological damage, excreted by kidneys. What are the signs and symptoms for lithium in a toxicologic emergency? Nausea, vomiting, diarrhea. What are the signs and symptoms for lithium in a toxicologic emergency? Polyuria followed by urinary and fecal incontinence, muscle weakness, neurological symptoms. What are the signs and symptoms for lithium in a toxicologic emergency? Seizures, coma, cardiac dysrhythmias, hypotension, muscle twitching. What is the pre-hospital management for lithium in a toxicological emergency? Supportive care, aggressive fluid resuscitation. What are the routes of exposure for methanol in a toxicological emergency? Generally oral, can be dermal, can be inhalation. What is the mechanism of toxicity for methanol in a toxicological emergency? Toxic metabolites are formed, result in profound acidosis, up to 5% ingested may be excreted by kidneys and respiration. What are the signs and symptoms of methanol in a toxicological emergency? 6 to 30 hours, intoxication, GI irritation, nausea/vomiting, abdominal pain, CNS symptoms, death. What is the pre-hospital management for methanol in a toxicological emergency? Supportive care, oral/IV ethanol therapy, gastric lavage, charcoal not helpful. What is the route of exposure for narcotics and opioids? Oral, intravenous, intramuscular, intranasal, dermal. What's another drug you can give for asthma besides Ventolin? Atropine. Why does atropine juvulate the crisis of asthma? Suppresses the action of the parasympathetic system, which result in only adrenergic reactions equal bronchodilation and vasoconstrictin, blocks the action of acetylcholine. What are some situations in which you would use hydrocortisone for respiratory and allergic reactions? Asthma exacerbation, anaphylaxis, inhalation allergy, urticaria, non-infected COPD. How much epinephrine would you give to a person in asthmatic crisis? 0.01 milligrams per kilogram, 1,000 concentration, salbutamol, ventilate, hydrate. Is anaphylaxis an indication for hydrocortisone? Yes. Is infectious inflammation an indication for hydrocortisone? No. Is asthma an indication for hydrocortisone? Yes. What is metoprolol? Bronchodilator for asthma. Why is acetylcholine used for exacerbation of COPD? It's not, it's contraindicated. Under which conditions would you use for aminophylline? Oldest bronchodilator, used when patients do not tolerate normal beta-2 drugs. When do you use racemic epinephrine? Much higher concentration than normal epinephrine. Subglottic edema. What is better, having epiglottic edema or subglottic edema? Subglottic, much milder. How would you treat subglottic edema? Racemic epinephrine, cold oxygen, hydration, antibiotic. Lansoprazole is a beta-1 stimulant. False. Proton pump inhibitor at the mitochondrial level to inhibit the production of hydrochloric acid at the stomach level. What kind of stimulant is levalbuterol? Beta-2 stimulant. What kind of selective is omeprazole? Proton pump inhibitor. Parasympathetic stimulation triggers bronchospasm, therefore ipratropium does so? False. Contraindication, can be used in asthma crisis as anticholinergic. Salbutamol is anticholinergic? False, effects are adrenergic. How much Ventolin do you use for an average adult? 5 mg x 3 doses. Does insulin increase glucose metabolism in cells? No, you are burning more sugar. What is the main natural glycogenolytic agent? Glucagon. What kind of gland is the pancreas? Endo/exocrine. What kind of diabetes is type 1? Does not produce insulin, insulin-dependent diabetes, immune origin. What happens with the cell during diabetes ketoacidosis? Glucose depleted, that's why they burn fats. What is Novolin? Recombinant human insulin. What could treat pheochromocytosis crisis like alpha and beta blockers, glucagon, sodium nitroprusside? Alpha/beta blockers, yes. Glucagon, no. Sodium nitroprusside, yes. In which disease do you find hypocortisolism? Addison's disease. In which condition do you specifically use IVT3? Myxedema coma. How would you treat urgent adrenal insufficiency? Hydrocortisone. In which thyroid defect do you find myxedema coma? Hypothyroidism. What drugs would you use for management of chronic moderate hypercalcemia? Biphosphonates or alendronates. What do you inject for hypocalcemia? Calcium gluconate. Can beta blockers be used in management of thyroid storm? Yes, absolutely. What is the name of the main thyroid-blocking drugs? PTU. How would you find the TSH in a thyroid storm? Very low, almost no chance of finding it. Glucagon is the antidote for what? Beta blocker overdose. Glucagon is the ideal IV treatment for hypoglycemia? No, dextrose is. Which drugs tend to end with lol? Beta blockers. Which drugs tend to end with pril? Angiotensin-converting enzyme inhibitors. Which drugs tend to end with sartans? Angiotensin II receptor blockers. Which drugs tend to end with dibenes? Calcium channel blockers. Which drugs tend to end with ide? Diuretics. Which drugs tend to end with cycline? Tetracyclines. Which drugs tend to end with psilin? Penicillins. Which drugs tend to end with mycin/mycin? Aminoglycosides. Which drugs tend to end with thromycin? Macrolides. Which drugs tend to start with ceph? Cephalosporins. Which drugs tend to end with fluoxetine? Fluoroquinones. Which drugs tend to end with acyl? Antifungals. Which drugs tend to end with navier? Antivirals. Which drugs tend to end with shetine? Selective serotonin reuptake inhibitors. Which drugs tend to end with PAM/LAM? Benzodiazepines. Which drugs tend to end with cane? Analgesics. Which drugs tend to end with Prozel? Proton pump inhibitors. Which drugs tend to end with tropium? Anticholinergic bronchodilator. Albuterol is selective for what receptors? Beta receptors. Is bacterial meningitis an indication for hydrocortisone? No. What are some synonyms for albuterol? Salbutamol and Ventolin. Does insulin increase glycogen levels in cells? Yes, insulin tends to increase the deposits of glycogen into liver. What is the role of hemodynamics? Blood flow regulation, maintains circulation, controls varying volume and distribution of circulating blood. Where is the sinoatrial node located? Right atrium, just below the superior vena cava. What is the natural pacemaker of the heart? Sinoatrial node. Where is the heart located? Mediastinum, behind sternum and between ribs 2 to 6, rests posteriorly on T5-8, apex on diaphragm points to left. How big is the heart at birth? Larger than diameter of chest cavity. When is the heart completely developed? By 25 years of age. What is the fibrous pericardium? Tough, loose-fitting inextensible sac. What is the serous pericardium? Parietal layer inside fibrous pericardium. What is the epicardium? Visceral layer adheres to heart surface. Where is the pericardial space located and what does it do? Filled with fluid, and separates the serous and epicardium. Provides protection against friction. What are the three layers of the heart? Epicardium, myocardium, endocardium. What are the four cavities of the heart? 2 atria, 2 ventricles. What are the atria? Two superior chambers, blood enters via veins and exits into ventricles. What are the ventricles? 2 inferior chambers, myocardium thicker than atria because greater force is exerted there, left is thicker than right due to distance blood has to be pumped. What is the function of valves? Permit flow in one direction only. What is the role of atrioventricular valves? Prevents backflow from ventricles to atria. What is the tricuspid valve? 3 flaps on right side, myocardium attached to cardi tendinae. What is the bicuspid valve? 2 flaps on left side. What are the semilunar valves? Half moon-shaped, in pulmonary artery and aorta, prevents backflow. What makes up the skeleton of the heart? Connected rings serve as semi-rigid support for the heart valves and myocardium attachment. What do the right and left coronary arteries supply? The myocardium, arise from aorta behind two flaps of aortic semilunar valves. Few anastomoses between arteries. What are the cardiac veins? Run parallel to the coronary arteries. Most drain into the coronary sinus, which drains in the right atrium. Where is the atrioventricular node? Right atrium along lower part of interatrial septum. What is the atrioventricular bundle? Right and left bundle branches originate in AV node, extends by two branches down to two sides of the interventricular septum, and continues as Purkinje fibers. Where is the cardiac plexus located? Near